Alright, this slide is showing us where a referred pain can sometimes occur. Referred pain means that if these organs are injured or they're inflamed, when they start to stretch and they get irritated, they will send out a signal through what usually is the dermatome. So as fetus develops, these organs somehow share these dermatonal tracts, and so although you would think that perhaps the pain, if it was in, for example, the stomach, if you follow that slide there, why would why would you not have pain just kind of right there in the middle? There you see where the heart is, and as it tracks down to the left arm and sometimes up into the left jaw, as the fetal development, it did follow the track of the diaphragm, and it did follow the track of that cutaneous branch down the arm. A lot of times you may have referred pain towards the back, as maybe these organs live just under in that hypogastric region, hypochondral region, hypochondral, just under the rib cage. They cause the diaphragm to be irritated, which causes that type of referred pain going towards the back and then sometimes up to upper quadrant. So just remember that pain will, although it may be localized to a particular organ, there may be some referred pain that we need to look for. So this is where we would use our OPQRST. This is the questions for a history of present illness. And we'd like to find that where particularly is that pain, what region, and then radiation. Does it seem to travel? Does it move anywhere? Has it always stayed there? And where initially maybe it started. These can give us really good clues as to what organ might be inflamed or injured. Now remember, the previous slides that we went over showed us the locations or regions that we would be palpating. So we got to gather information in several different methods. One is to ask questions to gather history using the OPQRST again, history of present illness, and the sample history. We'd also need to then conduct a physical examination of the particular area that's injured or inflamed. So in this particular case, what type of exam that we're doing is called a focused physical exam. Focused physical exam looks directly at that particular part of the body that is the main complaint. So we're not doing an entire head to toe at this time. We will eventually, but at this current time we're looking at specifically focusing in on where the complaint is, and then go ahead and do a good assessment, good physical exam to that area. Now to go over the exam that we're going to do is to palpate initially in those 4 quadrants. It's a bimanual technique where you use 2 hands, one hand's placed on the other. The hand that lays flat against the patient's surface of the abdomen is just for there to feel. We're then adding pressure on top of that fingers, and we're palpating in these 4 quadrants. We'd like to start off in the area where there's no pain, or at least there is least amount of pain, and saving the most painful site for the last when we palpate. What we don't want to do is irritate the entire stomach and give us a false exam where everything is tender, everything is sore, everything is painful. So besides palpating, remember that there's always look, listen, and feel. So we want to examine first, or observe. So we observe and examine the abdominal wall to see that it's symmetrical. There's no surgical scars, there's no outpouchings, there's no umbilical, the umbilicus, or the belly button is not protruding out. We don't see any type of hernias per se. And if we do find something that seems to be out place, like there's a bruise, discoloration, there's a outpouching, there's a surgical scar, we want to follow up at that time with our questions as we are doing our observed examination. We may listen to the abdomen. Basically, for you folks, I just want to make sure that we should hear some gurgling sounds. This means that the intestines are moving the products of consumption through the intestines, and we should hear a little bit of this type of gurgling going on. What makes it worse is if we hear no gurgling. That would be a really bad sign that everything is shut down and it's not moving. That would be important to know. Or we hear a lot more gurgling than we should. So if it's a lot of sounds, a lot of movement going on in there, there may be something that is worth mentioning. So we look, we listen, and then we do our palpating. Now, as we got through the 4 quadrants, if you do particularly find a special area, then we're gonna pay more attention to using our more elaborate scheme where it's a hypochondral region, the lumbar region, and then the hypogastric regions to describe more about where this pain is and how it moves. And then this slide particularly, we're trying to ask questions. Does it tend to radiate to this area? Did it always radiate to this area? And has the pain changed in any fashion or way?